Well, for more on this topic, I spoke with Matthew Wellington. He's the Antibiotics Program Director at the U.S. Public Interest Research Group. And I began by asking him how we got to this place of adding antibiotics to our meat in the first place.
It's been business as usual for a number of decades now to use antibiotics routinely to produce meat. And what's more concerning than just the sheer volume of the antibiotics that are used in meat production, in the U.S., that's roughly about 70% of sales of medically important antibiotics go to food animals. It's actually the way in which they're used that's more concerning. And that's because oftentimes meat producers, they will give antibiotics routinely to animals that aren't sick to make them grow faster and also to prevent disease from unsanitary and crowded conditions that they're living in. And that overuse is what we want to stop because it creates dangers for human health.
So help us understand why some people view adding antibiotics to meat as problematic while others don't.
It's all problematic because the more you use antibiotics, the less they work, and that's the simple truth. And when you use antibiotics routinely in the way that many meat producers do, that breeds drug-resistant bacteria. And those bacteria don't stay put on the farm. They can get off of farms and into our communities in a number of ways, whether it's on contaminated meat itself, through environmental factors like water runoff and airborne dust. And if you're infected with one of these drug-resistant bacteria, you could come down with an illness that is incredibly difficult and sometimes impossible to treat. So we could be looking at a world where antibiotics no longer work to cure infections, and that's concerning all around.
Explain the difference between the antibiotics used on animals when it comes to treating illnesses versus those used as a growth accelerator.
We absolutely think that if an animal is sick, they should be treated with antibiotics. The problem that we want to solve here is that a lot of the drugs are misused. And you mentioned for growth promotion, also they're used for disease prevention on otherwise healthy animals to compensate for unsanitary and crowded conditions. So that is where the antibiotics are used routinely and usually in low doses. And we see a huge problem because when you use antibiotics on a regular basis like that, you are just breeding drug-resistant bacteria that can infect people in a number of ways. So antibiotics should be reserved to treat sick animals if needed to control an identified disease outbreak, but they shouldn't be used on animals that aren't sick just to make them grow faster or to compensate for bad conditions. That's really the distinction there.
Why do you think people aren't doing more about it or being more vocal about it?
I think what it comes down to, again, is that it's been business as usual for a long time, and we are seeing major progress, to be clear. The chicken industry especially is moving away from antibiotic use on farms, or at least the misuse of those drugs. And we're looking now at restaurant chains because they buy so much meat, and 14 of the top 25 U.S. restaurant chains have committed to a strong antibiotics policy for at least some of the meat that they serve. So we're seeing progress, but we need to see more. And I think that the meat industry itself is so entrenched in using antibiotics routinely for production that what it's going to take is more major restaurants, these huge buyers of meat, to say, listen, our customers are concerned about this. We know the medical community is concerned, and so we want to completely phase out meat raised on routine antibiotics. I think that's the push we need to get more of the meat producers away from this practice.
So why do you think some restaurants then are being resistant when it comes to curbing antibiotics?
I think mostly what it comes down to is that they need to hear more from their consumers. So McDonald's, they've committed to no longer serve chicken in the U.S. raised on medically important drugs, and that's a commitment they've since fulfilled, citing consumer concern around this issue. Subway is in a similar boat. They've committed to phase out all meat raised on antibiotics in the U.S., again, citing consumer concerns. So I think really restaurants will make this happen if they hear from consumers about how they're concerned about this issue. They're concerned that antibiotics are being misused in the way that the meat is produced. And I think that if more restaurants hear that concern, they'll move away from suppliers that raise animals in this way.
So then for your average shopper who's either buying something off the shelf or buying something in a restaurant, what should they be thinking about when they're deciding whether or not to eat what's in that restaurant?
You can definitely check out a great resource that we have been releasing with our partners called the Chain Reaction Report. We just released the 3rd annual version of it this year in September, and that shows you which restaurants have committed to no longer sourcing meat raised on routine antibiotics. So that's a great resource that they should check out, and they can find it on our website at uspirg.org. And I think also pay attention to the labels. If you're in a grocery store and you're shopping for your dinner, look for meat raised without antibiotics. There are labels that say meat raised without antibiotics. You should pick those up. patronize producers that are doing the right thing when it comes to using these drugs, and also call on other producers to follow suit. I think that's the best advice I'd give for folks that are out there shopping and looking for this kind of product.
Which companies or interest groups or lobbying groups would you say have the most at stake with this issue?
I would say medical professionals have the most at stake because they rely on antibiotics to treat their patients, and they see that they're being vastly misused in agriculture. And so most of the medical groups are coming out sounding the alarm on this. The American Academy of Pediatrics, they recently put out a statement saying that antibiotics shouldn't be used routinely because of those dangers to human health. And then the World Health Organization, the global voice representing health issues, they just put out guidelines in November that very clearly state we should be restricting the kind of routine antibiotic use on healthy animals that is rampant in the meat industry. So I think health and medical professionals, they're really concerned about this, and they're calling on the meat industry to do their part when it comes to antibiotic stewardship.